live. How is this light? Let's continue from our discussion from yesterday. Good morning. See my mic. Good morning from this side. Who is awake? I'm sure it's evening, night in some regions. However, in Nigeria and West Africa, it's in the early morning hours. So welcome to the live. Where are you watching from? Thank you for joining in. Let me know where you're watching from. Who is forced to join in? Thank you. Thank you. Hope you can hear me. Let me know if you can hear me. Welcome, welcome, welcome. Thank God for a new day on this side. I don't know what time it is in your location. Hello, everyone. Welcome to the live. Welcome, welcome, welcome. Please let me know if you can hear me. Am I audible? Who is there? Thank you for the like. Thank you for the emoji. Mina Bujodi. Oh my God, that's. Thank you, Mina. Where are you watching from? Thank you for joining in. Can you hear me? Please let me know if you can hear me. RK Gaming, thank you. Saying I. Thank you. Where are you watching from? Okay, so you can hear me loud and clear. Thank you. I hope I got that correctly. Marina Bujodi or Bujod. Are you from France? Or where are you from? Please let me know in the comments, in the chat. Where are you watching from? RK Gaming, welcome to the live. I can see your laughter there. A laughing emoji. Okay, Marina says, welcome. Thank you, Marina. RK Gaming, watching from Montana, US. Wow, thank you for tuning in. It's always interesting to know that anytime I come up live about this time on this side, I have more people joining in from the United States. Of course, that has to do with the differences in time zones. Okay, RK Gaming, The 6M is watching from Texas, also from the United States. Thank you. Thank you. So, what time is it in your location? What time is it in Montana? And what time is it in Texas? Okay, RK Game is asking your country, streaming live from Lagos, Nigeria. Nigeria is the country. Lagos being the city, streaming from currently. So thank you for asking. Okay, let me use this. All right. Welcome. Kindly double tap on your screen to like the live. Please double tap on your screen to like the live. I'm so happy to have you all joining in. RK Gaming says African poor country. Is that really the fact? I don't think so. Okay, maybe when it comes to comparing with some other countries, okay, so not all African countries are poor. For example, Nigeria isn't a poor country, really. Okay, I think one major challenge with Nigeria is the management of resources. Okay, Nigeria is so blessed. All right, so RK Gaming may need to do some research and find out how much of resources are available in Nigeria. So, um, talking about poverty, poverty really is not in terms of what is displayed, even though that's what we assess in terms of the level of financial capacity, the health status of people in the country, you know, talk about standard of living and, all those. But in terms of availability of resources, God has so blessed Nigeria with so much, so many resources. I mean, talking about crude oil, talking about crop products, talking about, even the technology that it seems we are trying to catch up with. Nigerians are doing a lot, okay? And that's why you find Nigerians are doing greatly in different parts of the country, okay? Um, so, in terms of resources, there is no issue of poverty. Nigeria is so rich, Nigeria is so blessed, Nigeria is so full of resources. All right, but the management of the resources, of course, we talk about leadership, the management in terms of the leadership capacity, leadership style, the commitment, the policies. However, there are also roles for the citizens, and so each and every one has their role to play. Okay, for example, when it comes to the healthcare system, the government has their own role or roles to play in terms of provisions, in terms of infrastructure, in terms of good roads, in terms of having systems, institutions, hospitals in different parts of the country, and not just limited to urban areas, talking about rural settings where there should be increased primary care services being provided. Okay, so the government has their part. I mean, apart from the government, we have private individuals, we have non-governmental organizations who also do all they need to do to help to support. However, individuals in terms of decisions, in terms of habits, in terms of approaches, utilization of resources. These things also matter. All right. So, for example, if the government has produced hospitals, has produced doctors, has produced other professionals that are important for the healthcare system, and the structures are there, An individual, for example, a pregnant woman, can decide not to use the hospital-based services for antenatal care. Imagine what could happen seeking for, care for a mother and a baby, um, unborn baby, in a poor setting. When I say poor setting, in an untrained setting where someone is just trying to manage the pregnancy and the woman, someone is just trying to, monitor the labor, who is not actually trained, okay, who is not certified, so to say. Okay, people have experiences. So if such a woman does not take advantage of the provisions of the government, um, it may even be private sector provision, the fact is that there's a risk of developing complications with such a pregnancy. And so when something happens like that, we talk about morbidity, and we talk about mortality. And if, for instance, something happens, that can be termed to be related to poverty. All right. And really, it may not be poverty in terms of the physical, poverty of probably information, poverty of decision, the will to take a decision to do what is needful. So, in such a case, we won't say that, oh, the country is poor, really. We say maybe the individual is poor, poor in their decision making, poor in their mindset, and that can affect, the overall. If individuals are making choices like that, that can affect the overall experience and the assessment of the country. All right, so I think I've actually said a lot when it comes to trying to, is it project what it is really in my country, for example. USA best city, New York, Los Angeles, Las Vegas. Okay, that's interesting. All right, arcade gaming. Yeah, it's good to know that we have great places, beautiful places in the United States. And of course, um, the nation didn't get there um, in, in a day, and then a lot of commitment from both leadership and then the followers. All right. So RK Gaming says, "My dream, California." All right, that's interesting. Okay, maybe one day I'll come to California or New York, even to the the Washington D.C. Yes. Okay, all African in California. Okay, so we have Africans in California. Yes, in different parts of the United States, you find Africans, and then and all over the world, you find Africans and even Nigerians. All right, of course, we can talk about relatives, friends, families in different parts of the world. All right, so about one thing is important, and I was saying that earlier in my stream. RK Gaming, thank you. Um, Mafioso saying hello. Hello, Mafioso. I can see you there. Kindly give the live a thumbs up. Just double tap on your screen and like the live. Then kindly subscribe to the channel so you can get updates on the activities on the channel. So thank you for joining in once again. All right. So on this channel, we do a lot of health related topics. As you know, health is wealth. And interestingly, this month is Breast Cancer Awareness Month. And then I've been talking around this for some time. Experiences of individuals are unique and they are different, and their stories are different. So I've had different encounters with patients, individuals in different places at different times, in different conditions, and then I can tell you what some of the people, not some, what individuals, patients who have a diagnosis of breast cancer, what they need. All right. So Yesterday we started talking about the need for support in terms of communication, the ability um, to express themselves, ability to the opportunity that they should have, they should be given to communicate their symptoms, communicate their improvements, experiences with treatment, with people who are around them, talking about friends and families. That support is very important. I said during that session that there are some people who probably developed a symptom early, at the earliest possible time. They discovered that they had a symptom, maybe a lump in the breast, but because they have little or no interaction with other people, they tend to keep that to themselves, and then that could progress, that could become something bigger than they expected. Okay, so the role of relationships, communication cannot be taken for granted when it comes to symptoms, when it comes to health related conditions, and how people need to communicate. All right. So I was talking about the fact that every individual who has an opportunity to interact with a doctor needs to be expressive. You need to be able to communicate what's on your mind. You need to be able to let your doctor know your symptoms, know your challenges, know the improvements that you are getting, and that goes a long way to help your doctor to help you in helping you. All right. So apart from your doctor, you need support, even if it is not. I'm not talking about just breast cancer. We're talking about any health condition. People need support, and you should be able to receive that support from people around you, friends, family, colleagues, and everyone that can help to give that support. All right. I want to mention that there are some other things that an individual with a diagnosis of breast cancer needs. And that one is the physical presence. Now, of course, there are times that distance may not be helpful in being present, but there are people that may still be around an individual with such a diagnosis. So, being physically present, whether from the beginning or through the medical treatment, or it may even be surgical treatment that such an individual is receiving, at such a time, they need physical support. The presence of people they love, must be there. They should have a sense of they are being cared for, that they are being loved. That goes a long way in their healing process. If breast cancer is caught early, definitely it can be treated and it's curable. Okay, but many times, sometimes we have people who present late, people who already have complications. We believe, of course, God to perform miracles, but they have to go through some um, treatment modalities that may even be more intensive than those who have early diagnosis. So, at whatever point that an individual needs care, medical attention, it's beyond that medical attention. They also need support from individuals around them, physical support, not just communication, not just the phone calls, not just the messages, but the presence of one or two or three or four or more people. Interestingly, the more support they get, the more the psychological um, assistance that they may be receiving at such a time, letting them know that they are being loved, they matter, and are uh, they are they are being considered to be part of a family and a support system. So it could even be a religious setting, all right, but they need somebody. They need people around them. So if you have an opportunity to support someone who is going through such a health challenge, then see it as a very big advantage, a very big opportunity, and it's a great privilege that you have from God to be able to do that. All right. People don't know what people are going through. All right. And then um, sometimes people are not really able to express as much as they should. But when they receive support, it goes a long way. Let me know if you can still hear me in the chat. I hope I'm still audible. And if you are just joining in, welcome to the live, and let's connect. Let's know where you are watching from. Please introduce yourself and what time it is in your location. RK Gaming, what time is it in, where are you now? Is it California? Okay, Marina is in Texas. What time is it in Texas? Let's know in the chat. All right, so I was talking about that physical support. They need that physical support to assist them, in getting some things done. Things like lifting things, carrying things, moving things, and even in the hospital setting, some places, depending on the kind of setting they are in, they may still need to be helped to um, buy things, talking about feeding, talking about materials they need for their treatment. So such support will be well appreciated, and it helps a lot. It helps patients a lot. Okay, another important one, and uh, depending on the kind of service, health service that the individual is receiving and in their own environment. There are some people that are on the insurance scheme. There are others who have to pay out of pocket. So such individuals also need financial support. All right. So part of what a breast cancer patient needs is financial support. It takes a lot of money to even consult with a doctor. It takes a lot of money to run investigations. It takes a lot of money to buy medications. All right. So depending on your setting, for example, in some West African regions where there are limited provisions when it comes to care for cancer patients, of course, Nigeria is doing well. It can be better in terms of uh, what is being provided. Of course, there's cancer centers, radiotherapy centers now. Okay, but still, even if under the insurance scheme, some support still needed from the individual, from families, from friends, so that as much as possible, the financial burden can be reduced. All right, so financial support is another support that individuals with a breast cancer needs. All right, so I don't know how much of support you can give to that person around you in terms of financial support, but do well to support them, and I'm sure they will appreciate it. It will go a long way in their management. All right. I've seen patients, we've seen people who are not able to get some medications, people who are not able to run some tests because of the challenge or challenges with finances. All right. So if you have the opportunity to support financially, then that will be well appreciated. All right, that's another form of support. Okay, I need to say that that's being present sometimes. Um, if you don't know what to say, I sometimes I have a video. Okay, let me talk about the notes. I have a note on how to support people that are grieving. how to support people that are ill. Sometimes we don't know how to give them support. All right, so but there is something about also being silent but being present. Sometimes you are there so that they know at least that you care. Just visiting them, goes a long way. All right, and you don't know how much of impact that can make on their recovery. Okay, I need to mention very importantly. Let me get some water. Excuse me. Remember to give this video a thumbs up. Once you double tap on your screen, it will increase the number of thumbs up. And that way, the algorithm will be helping more people to join in to this very important discussion. All right, so I was talking about the very important kind of support, and that's the prayer support. Very important that we need to understand that many doctors, like myself, believe in miracles, and God is committed to healing people, even people who are suffering or dealing with breast cancer. All right, so our prayers will go a long way. Our prayers for them, for their healing, prayers for provisions, prayer for recovery. Some people have had the miracle of a lump, disappearing. Okay? Even if you don't believe it, there are people that have had that experience. All right, so and that's talking about the power of God to heal. We say that doctors we care, but God heals. So understanding the God factor will help a lot, and helping to support them with prayers is a very important one. Telling God about them, and you can trust God to bring a miracle, to bring a testimony to the lives of these people. So, whether as an individual, you can pray, whether as a group, you can pray for people who are dealing with breast cancer. And so we should not take for granted the power of God to heal. All right. And then some people who have a diagnosis and need to take certain treatments, whether medications, chemotherapy, go through surgery or and radiotherapy. Sometimes all these types of management have their side effects and complications. All right. So part of the prayers that you can pray is that they will not come down with complications from this treatment. A lot of people are running from chemotherapy. Some people, of course, run from surgery, and then maybe radiotherapy. Right, different people have responded, and this condition has been found. This condition has been found to be responsive to certain treatments depending on the stage of the cancer and the type of cancer. All right, so we've had people who have had more years than they would have had if they didn't take any action in terms of medical treatment for their condition. All right, so let me know if you can still hear me. Hello. I hope I'm still audible. Adjust this a bit. Am I still audible? Please let me know in the chat. I know sometimes the messages, the emojis, the thumbs up number of people being may not be reflecting, may not be the true reflection of what it is. But if you can hear me, let me know in the chat. All right. So talking about prayer support, so I talk about the need to pray that they will be responsive to the treatment. There will be limits or no side effects from the kind of treatments they will be receiving or they are currently receiving. So we must engage individuals, must engage religious leaders in the prayers for treatment or management as part of management for support for those who are dealing with breast cancer. Okay, that's the other support. So we talk about physical support, we talk about moral support, we talk about financial support, we talk about the prayer support. So what other kind of support do you think they need? All right, let me know in the chat. Talking about individuals dealing with breast cancer. You know that's the color. This color, pink, is the theme color for the awareness for breast cancer. All right. So I don't know if you know anyone dealing with breast cancer. I don't know how well you can support them. So if you have, please give them the support that they need. So I need to mention that beyond individuals, governments, institutions, non-governmental organizations need to do more when it comes to improving the health status of um, people dealing with breast cancer. Talking about the provisions, the health care institutions, improvements in facilities, making resources available, limiting their need to travel distances before they can access care. You know, there are some places, like in my country, there are a few places that can have radiotherapy, where people can have radiotherapy done, and people have to travel from one end to the other. People have to queue to have this done. All right, not because the resources or the capacity is not there, but there is a need for some commitment on the part of the government, to help people who are dealing with breast cancer. Thank you, Odongo Isaac. Welcome, Isaac. Where are you watching from? Thank you for joining in. Kindly give this live a like by double tapping on your screen. Thank you, Isaac. Where are you watching from? And everyone watching, remember to subscribe to the channel so that you can have regular notifications. After clicking on that subscribe button, you will see options for your notifications. So if you click on all notifications, you will be notified every time I come up live or when I upload a video. And watch out, there is a video coming up soon. It promises to be interesting and informative. So subscribe, click on all notifications so that as soon as the video drops, you are among the first to see and watch. And remember to engage with the video and videos so that I can know that you are finding them useful. All right. Of course, I get a lot of feedback from people from different parts of the world on the impact some of these videos are making on their health. All right. So beyond the views, beyond the information, the action part is very important. Where we take action relating to the things that will help us to stay healthy. All right. So I need to mention some of the risks risk factors for breast cancer. You know, the other time I talked about the symptoms that people should not ignore when it comes to breast cancer. Okay, but sometimes we just need to look at, okay, why has there been an increase in the incidence of breast cancer? Now, the major factor is the genetic factor, and then talking about passage of genes, family, passed from one generation to another. All right, but I usually say this for every genetic condition, medical condition. It is not automatic that because a generation previously had it, that the next generation is going to have it. All right. So if for any reason you have a family member who has had breast cancer, it doesn't automatically mean that another person in the generation is going to have it. And there are so many ways. I mean, the aspect of faith in God, standing against such conditions being transferred, just like you don't want any other strange or negative thing from your parents to be passed to you. So that's it. And then there are other non-modifiable factors. That's what we call them, like sex. Of course, it's more common in females than males, even though males can have breast cancer or breast disease conditions. All right. But okay, thank you, Odongo Isaac. Thank you for the like. Well appreciated. If you are here to double tap on your screen, remember to like the live, and that way more people can be notified by the system to join in. All right, so I was talking about the risk factors. What can predispose an individual to developing breast cancer? The risk factor. Talking about some genetic components in the black race, and interestingly, more people in other regions. Talking about the Western world. People are developing. I mean, people have been developing diagnosed of this condition. We can relate to talking about race, but talking about modifiable factors, the risk of disease or even cancers generally in individuals who smoke is very high. Individuals who drink alcohol is very high. People who have sedentary lifestyle, people who are overweight or obese, have risk beyond just cardiovascular diseases. They also are at risk of developing cancers. Now, inactivity, definitely. Talking about not walking, not moving, not engaging in energy consuming actions, activities can also be a risk factor. Other things has to do with diet. We talk a lot on diet, and we cannot overemphasize the effects. Interestingly, diet, your food is our first medicine, and if you are not eating right, of course, you are not treating your body right. All right. So if we talk about prevention, then we must be eating right. Talking about the need to consume vegetables and fruits. You don't get tired of doing that. They are not as tasty, as what do you call them? We call that cake. Not as tasty as ice cream and all that. Okay, occasionally, as an adult, you can, take some of these things. But having a healthy plate means that you are taking 50% of your plate being vegetables and fruits, about 25% maybe carbohydrates and 25% protein with some low fat. That's healthy diet. So when was the last time you took a fruit? We talk about this a lot, but how many people are really committed? It takes intentionality, it takes commitment on your part to feed right, to eat well, to eat correctly, whether in terms of what you are eating or in terms of the quantity, in terms of the timing. Okay, these are factors that influence our health. So, in terms of the type, we're talking about the benefits of taking fruits and vegetables. They have this antioxidative effect. They remove the things that stress our cells, move them out. Okay, taking apples, taking oranges. These are very important fruits for our health. Okay. What else? They need to increase water intake. Water helps to flush out toxins from the system, and this is very important. Exercising is very key. So, like I said, inactivity puts an individual at risk of developing a cancer. So, let me know, what questions do you have? What question do you have? Let me know if you have any question. All right, so I'm putting up a poll. All right, so can answer yes in the okay. Maybe I should change it. All right, so if you have any question relating to this discussion or any other health related question, please be free to ask in the chat, and I will help to verify as much as possible. Where are you watching from? So I believe you are able to relate with some of the information I've passed across, and then putting action to these things is what brings results. So let's do the needful to support people dealing with breast cancer. Where are you watching from? So, what time is it in your location? If you can hear me, what time is it in your location? Here is 4:10 a.m. West African time. What time is it in your location? All right, so we use a few more minutes to see those who will still be able to join in. So I want to appreciate Marina for engaging, being the first to engage in the chat. RK Gaming, thank you. Mafioso. Mafioso said, hello. Mafioso, where are you watching from? Then we have Odongo Isaac. Thank you for joining and thank you for the like. Thank you for subscribing. Let's see how much we can still do within the few minutes before we eat an hour. Appreciate everyone who has just subscribed. Appreciation to everyone who has just subscribed to the channel. There's some stretching. Okay. Right. So thank you for joining. Thank you for engaging. We're closing this session soon. We'll catch up again soon.